We would like to advise you the podcast you are about to listen to discusses bioenergy. There is no medical proof or definitive evidence to suggest that this course of treatment will be successful for you.
Hello, Si.
I'm with Dr. Diarmuid Tiernan, who specialises in an alternative therapy. We're going to discuss what that is and how it could help you and maybe learn something while you listen to this podcast. I'm a little intrigued. If you could sum it up in a nutshell before we start, how would you sum it up?
Bioenergy treatment is a treatment that works with the body's energy flows, naturally occurring energy flows that the Chinese have known about for many years. They use acupuncture in the energy channels, and the therapist will detect imbalances in the energy flows which are responsible for disease and then restore the balances using learned techniques.
So what kind of person would come to you in the first place?
Anybody, any illness, people with anxiety, depression, people with high blood pressure, people with arthritis, diabetes, asthma, the whole works.
And how did you get into this in the first place?
I got involved because my wife, bless her, she died of breast cancer. When she was poorly, she was advised to go and see a therapist called Michael in Ireland who invented the program. She'd run out of options on conventional treatment, so a friend of mine, Michael Flatley's PA, suggested we try Michael O'Doherty in Ireland. And he gave her some sessions which made her feel very good, and it kept her going for 6 months until she went to private treatment.
So what is the difference in the sense you go and visit the doctor who's practicing, and if it was a doctor of medicine, they'll put you on a course of treatments, no doubt, and they'll chat to you about how you're feeling or where it hurts and what makes you feel like this. What happens when they come and see you?
Okay, somebody coming to bioenergy therapist, the therapist will scan the energy flows in the body to check for deficiencies. Those deficiencies are responsible for ill health, and using learned techniques in the training program, they'll restore the energy channels and energy flows so that good health can be restored.
And how can you spot energy flow? Because it's not like a broken bone, I imagine.
It's not. Energy is invisible, but it can be detected. There are special types of photography can detect energy flows in the body. And a trained therapist who's themselves undergone some grounding so that they are calm and neutral can pick up changes in energy, in temperatures around the body and how the energy flows. And then by using techniques we've all learned in our course, we can help increase the energy flows in certain parts of the body, take away deficiencies, can help remove negative energies and negative thoughts at the same time. And doing that, it gives the client a chance to heal themselves.
So when people come, do they have to completely believe in this alternative medicine, or if they're sceptical, I imagine, is it a lot harder?
Maybe harder. All we require from the client is a commitment to change and a commitment to want to get better. And if they have that commitment, then it will work.
And how is this seen by GPs that practice medicine?
Most don't know about it, but I've got colleagues who are doctors like me who have learned the techniques and they've used it as an adjunct to ordinary medicine. I've known other doctors who trained in the practice go on to do bioenergy full time because they believe it's the way forward.
And are there any success stories where you can say this is because they had this rather than going down the other route?
The biggest success story is Michael Flatley, the dancer and choreographer. He was laid up for 2 years with a mystery illness that none of the doctors and specialists in the UK could sort out for him. He got introduced to Michael O'Doherty, the founder of the Bioenergy Institute in Ennis, County Clare. And after the first session, Michael Flatley was up out of his bed and walking. And after the 4 sessions in 4 days, he was back to full fitness.
So what would those sessions involve?
Involved, let's say the therapist, Michael in this case, the other therapist would be scanning his body for energy deficiencies. And without laying a hand on him, just redirecting energy flows.
Sounds amazing.
It is, and it's not a miracle, but it happens. And Michael, my friend in Ireland, has been on TV in Ireland, been on Ulster TV, been on Irish TV as well, explaining and getting people to volunteer for treatment. And they've all had positive success with this.
So does the patient feel a sensation? Or?
Well, you can feel a sensation. You can feel a hot or a cold sensation as energy flows change. And often they feel tired after the first couple of sessions. But by the 4th session, the 4th consecutive day, they feel stronger in themselves.
You say 4 days. I mean, what would an average length of treatment be? And would it depend on what was bothering them?
It's a standard treatment. We say to people, you could get a patient through the door and not ask them anything about their illness. Just give them the treatment and let them go away. Yes, it's nice to know what's wrong with some people, but you do the same techniques. You do specialize certain techniques to do for certain illnesses, but you can take anybody off the street with illness and say, right, we're going to help you move on from this. You have got a commitment to change. We'll help change your energy flows so you'll start to feel better.
And what do you think would be the number one reason then for someone actually coming to see you? You say, I heard this podcast on KLFM's website and I'm going to give it a go.
In most cases, people will come to me because they tried all the other routes and failed. In some cases, it's a last gasp. It's a last resort to come and see us, but it's something different. People have tried acupuncture for various diseases and found it helpful. Acupuncture involves sticking needles in the skin. This therapy involves no touch technique at all. It's all just changing energy flows from a distance of a few inches. And, people who've been treated for other illnesses before will try different medications. All medications have side effects. Some people are on 2 or 3 or 4 drugs at a time. Each one can interact to some extent with the other drug and cause unpleasant side effects, whereas this has no side effects, apart from tiredness for a couple of days, and then a chance to move forward and be healthy.
So obviously this is a private practice. How does it work when people come and see you? I mean, would I sit in a waiting room as if it was a GP surgery?
There'd be a waiting room. I do very little of this work at the moment because I'm still doing 4 days a week as a GP full-time. But there'd be a waiting room, probably some calm, relaxing music. The therapy room would have a chair and a couch with some soft music. And people will be put at ease fairly quickly. And once they're at ease, the treatment starts. And it takes 45 minutes to an hour for a session. And that's repeated for the 4 days. And then booster sessions can happen further down the line, depending on requirements.
And is there an age that you see more people at coming to see you, or is it any age?
Any age. I suppose I see a lot of young adults who are stressed because of life. I see older people with arthritis, Parkinson's disease, strokes, you name it. But across the board, there's every age group involved.
And you mentioned Michael Flatley as a case. Is it something people, if you like, in the limelight, people that are excelling, I guess, at what they do, is it something they'd maybe be more inclined to do?
I think so. I think Michael still has occasional top-up therapies, and he's certainly a champion to advertise the bioenergy treatment. He's helped Michael O'Doherty open a clinic in London. He opened the clinic for him. He had lots of celebrity friends, some who may have been had therapy at the clinic themselves. But he spread the word, certainly. And I think that has helped the treatment become, certainly in Ireland, very well recognised. In the UK, it's not so well recognised, partly because the NHS treatment is free. Who wants to pay for private treatment if they get free NHS care? You
touched earlier how you got to know about it through Michael Flatley's PA, but how long did it take you to gain an understanding and really, truly believe it enough to make other people believe?
I suppose after the first 4 days for my wife, where she benefited, was helpful, but I then decided to go and do the course myself, which involved going to Ireland for 8 weekends throughout the year. And each weekend we learned different techniques, we practiced on the other therapists, and felt better. I used to come back on a Monday morning feeling very relaxed until I went to work, and then it just went down the pan from there. But every time I went across, I learned a lot about myself, other people, illnesses, and the treatment and how it works. So I think 8 months to a year before I fully accepted that it had great benefits.
So what else can it cure?
I've seen people with asthma be cured. I saw one chap who was a keen footballer, who was a bad asthmatic. He was about 9 or 10, and he frequently had admissions to hospital because of chest infections and asthma. And after his 4 sessions, he stopped using inhalers, had no more hospital admissions, etc. I've seen people with Parkinson's disease get more mobility. I've seen people with diabetes improve their blood sugar control. I've seen people with anxiety and depression. I've seen people with ME who are very tired start to regain confidence and regain their strength.
You said also that you're a GP, so when people leave you on your 9 to 5, if you like, they may leave with a prescription to continue with what you've done for them. Is there anything that your patients with the bioenergy can do for themselves when they're not with you?
We teach them exercises. There's a CD by a chap called Mantak Chia, who's a Buddhist monk, who has developed a CD about healing sounds. There are certain sounds you can make to help heal your own body organs, and I give out copies of the CD so they can reinforce what they're getting in the sessions. They can practice that at home. On the CD there's some nice relaxing music, and they can put themselves into a sense of relaxation and start to heal their organs and feel better as a result.
So how would someone, if they're listening to this now, thinks, this sounds quite intriguing, interesting, how would they get in touch with you?
Well, I'm advertising on KLFM at the moment. It's West Norfolk bio-energy.com, and there's a website there available with contact details.
And all of the information that we've discussed, I guess, is on the website
It's on there in one format or another, yes. And there are links to the main teaching centre in Ireland, the Plexus Bioenergy Institute. All the information is there and can be resourced, yeah.
And where is your base in West Norfolk?
In Terence St Clement.
So they just come and see you there, do
Yeah.
they? Just click the link on the page that you're listening to this podcast to find out more. Thank you for listening to our podcast on bioenergy. There is no medical proof or definitive evidence to suggest that this course of treatment will be successful for you.